If you've been injured, finding the right orthopedic surgeon can be a difficult task.
In Health Watch, Charlie Botat tells us how Aurora BayCare Medical Center's specialized orthopedic care focuses on the patient's individual needs.
Pamela Nikodim's passion is music. The accomplished musician played in an orchestra for 10 years.
Music is like my breath.
Making music was something she thought she may have lost forever. In 2014, she slipped on the ice and broke her elbow. She had multiple treatments and surgeries, but was not able to go back to playing her instruments.
A lot of emptiness, and I was angry and frustrated.
But she still hoped to eventually play again. Then, in 2017, she fell again. This time, she hurt her wrist. A doctor told her,
"It's better. You'll be better. You'll be fine."
But it didn't get better.
It was hurting all the time. I could no longer move my wrist. I couldn't do a lot of things like curl my hair, put makeup on easily.
That's when she decided to go to Aurora BayCare Medical Center, hand fellowship trained orthopedic surgeon, Dr. Brian Klicka.
We did diagnostic testing with an MRI, which gave us insight to this ligament tear in the wrist.
I felt validated on one hand and like, yes, there's an answer.
Pamela first chose to go the conservative route.
Because we know that there's a handful of patients that actually can get better with injections and therapy, it's our attempt to avoid a surgery, which is always, our first hope.
It worked for a while, but then she re-inflamed the dormant injury.
I was not sleeping. The pain was probably a level 7 on a consistent basis.
So in September, Dr. Klicka performed a minimally invasive wrist arthroscopy.
We basically went in, diagnosed, and then through, again, a small incision, we were able to fix it with suture.
I don't have pain. I can move my wrist. I can go in circles. I can actually hold a bow now.
Dr. Klicka says Aurora BayCare offers specialized orthopedic care, making sure patients see the right subspecialist.
For me, just hand, wrist, and elbow. So I think we do a great job of getting patients into those individuals, and we really optimize outcomes.
Care that focuses on the individual patient.
You really have to listen to what's going on and make sure that you individualize their care based off of what the issue is.
I feel like they listen to me.
By January, Pamela was finally able to pick up her bow again on a limited basis.
Like, oh my gosh, I'm going to play again. This is awesome.
Now Pamela is teaching violin and piano to kids. Although not yet fully recovered, Pamela believes she will be back to doing what she loves.
I want to play in an orchestra again.
I think she's going to get very close to doing everything she did before.
Dr. Klicka says those who could benefit from wrist arthroscopy is anyone that has chronic, subacute, or acute wrist pain that an MRI shows could be a ligament tear, where conservative methods have failed. To learn more, you can call Aurora BayCare or email HealthWatch at aurorabaycare.com. And that's your Health Watch. I'm Shelley Botal, Local 5 News.